Ladies and gentlemen, good morning, good afternoon, good evening, wherever you are listening to us. Welcome to this edition. We are welcome to this educational series hosted by the Southern Cameroons Medical Society. My name is Lambert Mbom. I'm the Executive Director of the Southern Cameroons Medical Society. And today we're joining the international community to celebrate the World Hepatitis Day, which took place last July 28th. We have a panel of great journalists, great physicians, Southern Cameroon's physicians based across the world. For now, we have three people on set. Where we are hoping that we are going to get many more. And this conversation is going to educate us about hepatitis, different types of it, how you contract it, how it's diagnosed, and what to do if you contract hepatitis. I'm going to pass over to Dr. Foster Dieter, who is going to lead the conversations. And Dr. Foster, thank you and good morning.
Mr. Lambert, Dr. Menjo, Dr. Ochebufor, ladies and gentlemen, distinguished audience and fellow colleagues, thank you for taking a portion of your morning to gain more knowledge and to share your experiences about dealing with hepatitis. This week we celebrate World Hepatitis Day. July 28, 2020 was a spelled out day for this year. We take a moment to reflect and know that this is a major healthcare crisis within the continent of Africa and particularly in the southern Cameroons, that we have had enough knowledge and great advancement towards getting this under improved control. During this 1 hour session, we hope we educate, we hope we answer your questions, and please do take a moment and comment on the chat forum so we make sure that this presentation addresses you adequately. Today, we will try to cover what hepatitis really is, what kinds of hepatitis are there, how you get hepatitis, how you manage hepatitis, how you prevent hepatitis, and what the potential downstream consequences are. I have no doubt that this panelist is quite experienced and competent to address most of your day-to-day issues regarding hepatitis. I am a gastroenterologist and a hepatologist by training, so I will defer this question to my colleagues. But before I come back to answer the question of what is hepatitis, please allow me the pleasure to introduce the rest of our panelists that are currently on. Dr. Menjo, please, can you introduce yourself to our audience today?
Good morning, fellow colleagues and all the people of Southern Cameroons listening to us on this special day of World Hepatitis Day. I am Dr. Austin Menjo. I'm a practicing nephrologist. I also trained in transplant nephrology, and I'm currently with Tower Health, which is a health system that lies between the two major cities of Pennsylvania, between Philadelphia and Harrisburg. That's the territory of the Tower Health, and we are under the Drexel University. So I'm a practicing nephrologist, and we do see a lot of kidney diseases that are related to hepatitis C. Actually, when someone shows up in the hospital with unexplained kidney failure, part of the workup includes making sure that they do not have hepatitis, and the kidney involvement in hepatitis is what we tend to call bystander injury. The disease itself is in the liver, and the kidneys, whatever they end up having, suffering, just bystander injury. And it can span from the acute to the chronic to the end stage. And we'll be able to, just make a brief overview of some of the issues those of us in this kidney world deal with as far as complications related to hepatitis. So I'll be happy to come in and and help break it down for those who may not have been aware that kidneys do get involved in liver diseases. Thank you, and hope you have a wonderful time with us.
Thank you, Dr. Menjo. Dr. Chebufo, I'm not sure if you've come back to join us during this presentation. Dr. Chebufo is a very experienced physician who trained back in the Cameroons. He spent time internationally, including in South Sudan, in the Central African Republic, in China, and is currently in New York. From my works and editing and co-authoring manuscripts with him, I know he's an experienced person in handling diseases that are prevalent in the sub-Saharan African region. Dr. Chebufo, I know you're at work, but you've created this time so you can help educate us, your colleagues, and members of the Society of Southern Cameroons. I don't know if you've made it back on screen or not. Mr. Lambert is
Dr. Chebufo just dropped off. I think he should be coming back in a minute. I would indicate to you, so you can just write on.
Okay, and we're also hopeful that Dr. Ivor, who has co-authored some of the world-renowned papers on the hepatitis E and hepatitis C, will be joining us during this presentation. If he's listening, we hope he quickly creates that time to join us. Ladies and gentlemen, so let's dive into the subject matter that we're here to discuss. Hepatitis. What is hepatitis? Broadly speaking, hepatitis refers to irritation or inflammation of your liver. In medical terms, we also call the liver the hepatic organ. And so inflammation of the liver is called hepatitis. Inflammation of the liver can come in different flavors. It could just be an infection. It could even just be different things that are irritating the liver, including medications. Today, we would zero down on hepatitis that's coming from infection. There are multiple infections that can also cause hepatitis. CMV, EBV, bacteria, parasites, those things can all cause infections of the liver. Today, we want to focus on the hepatitis as it relates to viruses. And the viruses of interest today will be hepatitis A, hepatitis B, hepatitis C, to a lesser extent, hepatitis D in the existence of hepatitis B, and hepatitis E. So as we progress through the hour of discussion, we would focus our attention on discussing hepatitis A, B, C, and E. The first distinction point is some of these.
Dr. Foster, let me just stop you for a second. So my understanding is, in simple terms, hepatitis simply means an inflammation of the liver. And there are different types of hepatitis, A, B, C, D, and E. And these could be caused by, the inflammation could be caused by bacteria, some could be caused by virus, and we just want to focus on a couple. Am I
right? A, B, C, and D are the viruses. That's where we are focusing on. I did not make mention. The viruses we are focusing on.
Okay.
A, B, C, D, and E.
Okay, go ahead. I just wanted to be sure.
Some of these viruses will cause chronic infection, and some of them will mostly cause an acute infection. Chronic infection means when you get it, you live with it for a long time, and it can have downstream consequences. An acute illness, you get it today, it lasts for a week, 2 weeks, a month, and it's gone. You don't need it again. So we would also discuss those two areas as it pertains to these different aspects of hepatitis. My colleague here, Dr. Menjo, would frequently see patients that have chronic hepatitis. because its downstream consequences would involve damaging other organs, particularly the kidney. So, Dr. Menjo, oftentimes we get patients referred to us from nephrology that look, this patient has got deteriorating kidney disease, and we think you have to address their hepatitis for this to get better. Um, uh, in our experience, it's mostly from hepatitis B and hepatitis C. Could you give us, shed us more light of the reverse detective work you do in order to uncover and send these patients back to us?
Okay. Thank you, Dr. Foster. Well, when we see somebody with kidney failure, we start to do the detective work, and the detective work is to answer the question why. Why are your kidneys not functioning 100%? That's where everybody should be. That's the normal state. Is it something that is potentially reversible? Is it something that is irreversible? And as it pertains to viruses, to especially hepatitis B and C, which are the hepatitis viruses that are involved in either acute and chronic kidney diseases. They tend to affect the kidneys, the kidney function at specific areas, and we have a couple of kidney diseases that are often related to hepatitis, and to help those who to help the common man, to help the other physicians who may not understand where particularly the kidneys are affected by hepatitis, would like to give a little bit what is called the anatomy of the kidney. Then you can be able to situate where exactly these hepatitis viruses end up affecting the kidneys. And before, so we tend to have what is called a functional unit of the kidney, and it's called a nephron. Is if you had to dissect the kidneys and go down to the smallest unit that is responsible for doing all the work that the kidneys do, it's called a nephron. And the nephron has a filter. We call that in medicine glomerulus. And this filter has a blood vessel that supplies it and one that drains it. Then there is a little barrier that separates the filter from the collecting system called the tubules. And for the common man, it's if you have a water filter at home, you have water that you pour on top of the filter, then the filter does the work of clearing all the dirt, and then the clean water collects in the bottom. So in the kidneys, you have the filter, you have what is called a little barrier that separates the filter or the glomerulus from the collecting system. And this is called the glomerular basement membrane. This is like a little fence that separates two tissues from each other, because that is where most of the damage to the kidneys as it relates to hepatitis occurs. This little barrier that is called the glomerular basement membrane, that's where most of the diseases affecting the kidneys as it relates to the hepatitis viruses is concentrated. So we do have a couple of conditions that we use medical terms for those physicians that have been in the hospitals and they end up having a patient with an AKI or chronic kidney disease and get the nephrologist involved. If it is hepatitis B, there are a couple of conditions that are associated with chronic hepatitis B infection. We have
Dr. Menjo, let me just stop you for a second because you just mentioned something that is a very important for people to understand. I want us to go back. Just explain to us what is the function of the kidney. And in explaining the function of the kidney, you have just told us there's a filter and there's a barrier. And most of the things then, is it that the filter is not working or the fence is not working? And what is the relation? So what is the function? What is the function of the kidney?
Okay, well, you know what? I always tell my patients who show up for the first time with a kidney condition, and they tend to expect a symptom, but typically, if you had to wait to have symptoms of kidney disease before you went to the doctor, it will be too late. So when I teach or explain the function of the kidneys to the lay people, to the patients, I give them this analogy. I use analogies. I give them, look, imagine you are home. Your home is, let's say your body is like a home that you live in. And imagine that the home is very beautiful and pretty from the outside, but somebody needs to be cleaning it from the inside. Meaning, when people come in, have a party, they eat, they drink, and leave stuff around, that that is dirt that needs to be cleaned and flushed for you to live and breathe in a very healthy environment. So the kidneys in the body do this background work of cleaning up. I always call them the housekeeper. Those who have been in hospitals and in hotels, when you go into a beautiful hotel room, beautiful hotel, and everything is sparkly and shiny and clean, do you ever stop, and ask yourself, who is cleaning up this place? Who is cleaning after me? When I go into a beautiful room and it's shiny, all the sheets are clean and it's smelling nice. Who is doing that work? It's called the janitor. So the janitor of the body is actually the kidneys. They do this cleaning in silence. And what you see as debris is the urine that flows out. So the the urine that you see flowing out of the body, in that urine, the kidneys have dumped a lot of waste. And the filtering starts in the smallest unit called the nephron. So you have that filter. That filter, that is where most of the work of the kidney is done. So it filters everything. The blood that flows through your body is filtered through that glomerulus. And there is a little collecting system that we call the tubules. If you had to use layman terms, you would call that a funnel. So it collects all of that urine and all the dirt, and then it flows through the tissue of the kidney all the way and out into the bladder. So
Okay.
there is a barrier between the filter and the funnel. So this is called the glomerular basement membrane. It's like a fence that separating two neighbors. If you have two homes, one is on the right, one is on the left, and you have a fence in the middle. So the kidneys, they have that little fence called the glomerular basement membrane. And when the hepatitis, when the kidneys are involved in hepatitis, it is that membrane, it is that barrier that is often affected. And there are consequences that I can talk about as we move along.
Thank you very much, Dr. Austin. And let me come now to you, Dr. Foster. You already explained to us that hepatitis is an inflammation of the liver. Okay, so tell us, what is the function of the liver in the body? And then we get to how when this is this inflamed, how this hepatitis affects the body.
Thank you again, Mr. Baum. The liver is a very central organ in the body. It essentially receives all the nutrients on their first pass from the intestines, processes it before it gets released to the rest of the body. The liver also acts as a storage organ, holding on to iron and other important minerals. In addition to the kidney, the liver is very important. It takes out toxins from the body. You can imagine all the junk that gets into the body through the intestines. The liver is the first pass at preventing those from gaining access to the rest of the body. You can therefore imagine that things that compromise this biggest by which in the lead to deleterious consequences. The liver has two main blood supplies, one of those mainly dedicated to receiving everything from the intestines, and another one dedicated to receiving its oxygen from the heart as well. I think in big terms, that's really what I wanted to share with you today about the liver, as I think more specifics are beyond the scope of this presentation to our audience. Now, you're
Dr.
right
Foster,
that
Dr. Foster, your lighting is a little problematic. I don't know if there's any way you can do something about it. In the image I have is blurry. Do you have any way of making that brighter? If not, we are going to. I mean, it's not too bad, but we can deal with that. But I just wanted to let you know that it's kind of blurry. Go ahead. Let me see. I can do something in the background. Just.
Is it any better?
Let me see something. Okay.
Okay.
Go ahead.
Okay. So we when we talk of World Hepatitis Day, though we talk of hepatitis A, we talk of hepatitis B, we talk of hepatitis C. That's just one of the organs that is affected. In fact, maybe that's what brings it to light. But as Dr. Menjo just made mention of, it may be a reverse detective work that points out to the liver. Partially because these are things that are happening in the background and are happening silently in a way that people may not be able to appreciate. Hepatitis B and hepatitis C in particular are things that cause long-lasting disease for some people. Hepatitis B is very common, and so is hepatitis C. But the good news, effective methods of all of us can pay attention. They both almost because they are transmitted in similar ways, but very differently. From
Dr. Foster, I think we are having a technical problem with your sound. Can you just check that for a second? Dr. Austin, while Dr. Foster is checking that out, let me come to you and find out. Now, you talked about hepatitis B and C. How are they contracted? I mean, from your point of view, how do we get that? How would somebody contract hepatitis B, hepatitis C from?
Well, hepatitis B, and most of these viruses are contracted through blood, and some may also be sexually transmissible, especially hepatitis B. And then for the mothers, they acquire the hepatitis B either sexually or those who have had blood transfusions or organ transplant, and then they can get it to their offspring. So most kids have what is called maternal fetal transmission of hepatitis B. So that's what they acquire from the outset. And most of the time, if the mother was not screened, then you may never know that the baby is affected until later on in life. And then again, if you get in contact with the blood of somebody who is infected, and hepatitis B is highly infectious. And then for the hepatitis C, intravenous drug use, particularly it is very prevalent in that population. And then in America, particularly, the population that is also affected are called the baby boomers, and these are people who are now in their 70s and who acquired these infections in that period where blood transfusion, the blood was not, the screening was not 100% effective. So most of them, who never got involved in any illicit drug use acquired the virus through this means, meaning it was through the hospital that they got it. I will let my colleague Foster his back, answer, because this is his area of expertise, and he knows more about the transmission of hepatitis B and C than I do.
And thank you very much. I apologize for this breakdown in network at the most crucial point of our conversation. I hope our message can still be transmitted. Dr. Menjo is right. In simple terms, hepatitis B and C are transmitted through blood. If somebody with hepatitis B and or C exchanges blood with you, there is a high chance you are going to get hepatitis B and or hepatitis C. Therefore, let us imagine the common ways in which that blood can come in contact with blood. Dr. Menjo made mention of some. If I use a needle and leave a stint of blood on it, and you use the same needle on yourself, if that blood was contaminated, not only hepatitis, including HIV, if that blood was contaminated with any of those viruses, and you get that blood and mix it with your blood, you're going to get it. Same kind of thing in pregnancy. At the time of delivery, if the blood of a mother mixes with the blood of a child, and the mother happens to have HIV, happens to have hepatitis B, happens to have hepatitis C, the chances are high that the baby would also emerge from that scenario more likely to have one of those viruses. Blood transfusion. If you go to the hospital and donate blood and it's not carefully screened, and somebody just grabbed it in a hurry and give it to you without looking at what makes up that blood, and that blood happens to be contaminated with hepatitis B or hepatitis C, you are going to get it. Therefore, making sure that your blood does not mix with somebody's blood without carefully being screened is a very important aspect of preventing hepatitis B. Now, and C, hepatitis B is also highly transmitted through sex. That is because and even hepatitis C, less so than hepatitis B. But that's because it also lives in body fluids. It lives enough in semen and in female secretions that the act of intercourse can transmit hepatitis B. Same kind of deal goes with deep kissing. Anything that exposes somebody's body fluids to your body fluids in a membrane that's not smooth would improve the chance that it will be transmitted. No wonder another means of transmission is we worry about people who do drugs. Why? Because while they're doing drugs, they are high. They don't even pay attention of their surroundings. They are so eager to grab the needle from their friend to themselves, and they transmit it. People who have, men who have sex with men, they use the wrong body organs and they roughen an organ that was not meant for that in the first place, injure it, and if their fluid, their semen happen to have had the virus, then it's easy to transmit it to the next person. So these are some of the ways through which people can transmit it. Mothers can transmit it to their babies through in utero, meaning it can go from the mother through the placenta to the baby. But the majority of it occurs at the time of birth, when they're trying to snip the placenta, when they're trying to cut the umbilical cord. And you can imagine, if you've ever been involved in the birthing process, there is a lot of blood. And so if that blood mixes, then there is a high chance that the baby will get blood. So those are babies that are condemned to be born with hepatitis B, if that happens. But during life, they can acquire it if blood mixes. Blood transfusions, needles. Back home, there is a practice, and I think our medical community is getting better. Back home, we used to use needles. You go to the hospital, you need an injection, they inject you. They do not dispose of the needle. The bucket called the sterilizing bucket, so they can boil it, so they can sterilize it and bring it back to you. If that's not effective, if that sterilization is not effective, then they can also transmit hepatitis B, hepatitis C, and HIV to you. Certainly, in a resource-rich setting, they will just dispose of needles. They will make it a single-use needle. Yes, Mr. Lambert.
Yes, that is quite interesting because very often when we talk about, I mean, when you talked about the inflammation of the liver, that got me thinking because I think most of the time for people who drink, there's something called liver sclerosis, if I'm pronouncing that correctly, isn't it? So we are saying many people are afraid to drink or they are being prevented from drinking in order to keep their liver healthy. And today we are getting a different, some other form of attack on the liver, which is kind of the blood, isn't it? You get hepatitis if your blood is contaminated with the blood of somebody who already has that. So there's I even want to say triple jeopardy. For somebody who drinks, he can damage the liver in that sense. And then for somebody who has HIV, you can also have HIV plus hepatitis B. Am I right in understanding that?
And it's not just additive. Okay, there's something called synergistic effect. You're very correct. You see, in some scenarios in mathematics, we commonly say 1 + 1 is 2. When it comes to alcohol plus hepatitis, or alcohol plus hepatitis plus HIV, it's not 1 + 1 + 1 = 3. It's 1 + 1 = 5. So 1 is bad enough. 2 is terrible. And so anything you can do to minimize compounding the effect, the better outlook you may have. And I'm glad you brought me back to this conversation because don't forget the liver is hidden inside the body. Something has to bring it to the liver. And so there is a medium of transmission. It has to evade the body system to hit the liver. And the body is interconnected. The liver is not separated from the kidney. It's not separated from the brain. It's not separated from the heart. They talk to each other and they share intelligence and information. When we focus on the hepatitis, that's because this virus has a love for the liver. It circulates in blood, goes by the brain, and it says, "I don't care about you." Goes by the liver and says, "I don't care." It goes by the heart and says, "I don't really care about you." But when it finds sharp in the liver, it really cares about the liver, and it goes after the liver. The liver is its vulnerable soft spot. And so when we talk of hepatitis, we are referring to things that may be in your toe, may be in your saliva, may be in your semen, may be in your vaginal secretions. But when it gets into the body, it has a love and a predilection for your liver.
Excellent, Doctor. That's very great. And so now to you, Dr. Austin. So you find that interconnectedness, and that is why you were able to say that somebody comes in and maybe they were complaining of something else, and you're looking at it and you're not seeing that the problem is with the kidney. And then you have to go, that's a downstream, if I understood what Dr. Foster was explaining before. So how would that be connected? How is it that the liver has a problem, but the person is having symptoms of something that is affecting the kidney already? In short, how is hepatitis related to the kidney?
Okay, so well, sometimes for a layman, it is very difficult to understand how these organs that are different are interconnected. But you'll be shocked the way the body was put together. It was put together in a very, very perfect way, and there are links, little links like chains. There are big chains and there are little chains, and every single one of them must work in sync for you healthy and have a healthy body. So this disease has a predilection for the liver. It sits there. That's its home. And then as the liver gets damaged, there are a lot of things that happen. When you have an invading organism, what happens is something that is foreign to your body. We call, they tend, like the viruses. So the body has a way of trying to fight back. Okay, the body is not just going to lay there and do nothing. The immune system is able to recognize it and try to defend yourself from. Otherwise, we will be dead in one day. If your immune system we are not alive, you will be dead because every single day your body is bombarded and invaded by these organs, and then there is this innate system that is fighting back. So the virus comes in, and it's called an antigen in medicine. So the body, what does the body do? The body makes its own weapons against this virus, and these are called antibodies. Then these antibodies, unfortunately, do not completely neutralize the antigen, so they form little complexes. These are little bundles of the antigen, and then the antibody. And most of the kidney damage is done by these complexes that end up settling directly in the kidney. So the complexes circulate in your blood, and the smallest blood vessels in the body are actually in the kidneys. The smallest. It's like you have a boulder that is rolling down a stream. It rolls down until it stops when the flow, or when the channel becomes so narrow, then it stops there. So most of the kidney damage from the viral infections directly are related to these antibody complexes that end up settling in the kidneys. And when they do settle, they also elicit a local inflammation around the spot, meaning you have a boulder that rolls down the stream, it settles finally at some spot. The body does not just let it sit there. There is an inflammation that develops around that complex, and it's an immune complex. So in the kidneys, like I said, these immune complexes that are constituted of the viral particles and the antibodies end up settling in that little barrier that I call the glomerular basement membrane. That's one thing. Now, if the liver, God forbid, ends up being damaged and is now cirrhotic, scarred, then all hell breaks loose. And as Dr. Dieter is gonna eventually tell you, liver cirrhosis, once it's there, your whole body, because the liver is at this intersection between, it's like heavy traffic. If you have a big truck crashing at an intersection, what happens to traffic? It's blocked in every single direction. So the liver is like a big truck. Once it is cirrhotic, it's like a big truck that is crashing at an intersection, and the kidneys are in the background. So the liver that is going down is like a big tree. It is crashing and is taking along whatever is around it. So some of the kidney damage that we do see in the end, I'm saying in the end, when the liver is now cirrhotic, because these viruses were untreated, were left untreated, then you have another type of kidney failure. This one is not from immune complexes, but it is from the direct injury. When the liver is scarred, and remember, there's a lot of traffic that goes through the liver. It's scarred, it becomes very shriveled. It blocks the channels through which blood is supposed to flow. So most of the blood flow is pulled around the stomach. And in the kidney world, we call it the liver has stolen blood from every and starving the kidneys and starving the other organs. That's why you see these patients who are cirrhotic, they have a pot belly, but the whole body, the only thing that is swollen is the belly with fluid, and the legs with the fluid that is pulling in the lower extremities, and everything else is all thinned out. So the kidney is actually being starved by the liver. I can
So,
come back to specific diseases.
This,
so Mr. Lambert, if it's okay, I'd like to just jump in.
yeah,
What
absolutely. I was
what
gonna-
what Dr. Menjo is discussing is, hey, we've talked of hepatitis now, and I've also said it's a silent disease. It may take years to come. How do you know you've got hepatitis? What are some of the warning signs? Okay.
Exactly.
One, it may be that your kidneys have failed, and then you go to Dr. Menjo and he's doing the reverse walk. But many people may not know it. Some people would know it because your eyes are going to turn yellow. Now, if you look at your eyes in the mirror, they look white. The white of your eyes will turn completely yellow, and people will call that jaundice. Dr. Menjo fails to say people may come to his office and complain about the color of their urine. The color people will commonly tell you is it looks like Coca-Cola. I am having Coca-Cola urine. That's also the same stuff that's making your eyes yellow that's being peed because it's now circulating all over the body. In medical terms, they call that jaundice. Because the liver is a key organ in the body, and if it's not functioning well, people feel drained out of their energy. We've made mention of this concept of feeling drained out of your energy with COVID-19, but it's also true of people who have acute severe hepatitis or even chronic hepatitis. They feel exhausted, they feel tired. And he's also right. If this has gone on for a long time, it leads to changes in the body. For example, your belly begins to swell because the handling of fluid and water in the body is messed up. I also alluded to the fact that the liver purifies toxins from the body. Now, if your liver is unable to purify toxins from the body, they escape into the body, into the systemic circulation, takes over the brain, and can play tricks on your mind. And in medical terms, you hear people talk of encephalopathy.
Yeah.
So those are some of the manifestations of cirrhosis. Now, when we start seeing your eyes turn yellow and things like that, then it may push us to do investigations. But don't forget, there are a lot of people that have silent killers. Hepatitis, for a majority of people, is a silent killer. By the time your belly becomes swollen, by the time your eyes become yellow, it may be decades down the road. So how do you find out today or tomorrow that me sitting here and talking to you may have hepatitis? Look, there is nothing that prevents me sitting here and talking to you from having hepatitis. And I would say same about Mr. Lambert and same about Mr. Menjo, Dr. Menjo. The best way to know is to do what we call preventative maintenance. When you go to the hospital every now and then, they will run some blood work. Now, one of the things they would run is called your liver enzymes, your liver test. Please always ask them, what are my liver numbers and what do they mean? Because if this inflammation is occurring gradually over time, it may also only show a small signal that only your blood work will pick it in the early stages. And it's only later down the road that all of this has accumulated and added up that we're beginning to see the big picture. So one of the key take-home points I like people to take from here is, gee, when you go in and they're about to do your maintenance blood work, at least once in a while, they should check your liver numbers. Because if those are off, that speaks to inflammation of the liver. And we need to work with you to try to understand what's driving this inflammation of the numbers. And those numbers should also include your kidney numbers, because if those are out of whack, it will be a signal to send you to people like Dr. Menjo, and maybe in reverse detecting, they may also investigate and say, but why are your kidney numbers getting out of whack? And it's part of those that will uncover some of these diseases that can give us a chance to prevent it from deteriorating down the road.
No, thank you very much, and I think that is helpful. We want to welcome Dr. Tunga For. You just talked about the kidneys. Now we have somebody, a cardiologist, who can also give us how this can impact. Because again, the important point here is the whole body system is so interconnected. And while somebody may be complaining of some cardiac issues, the problem might have stemmed in from what we are discussing today, that the liver could be the problem. Dr. For, welcome. Dr. Tunga, can you hear us?
Hey, it looks like he may be having some.
Dr. Tunga, can you hear us?
No.
Okay, so let's get to, while we try to sort that out, let's get to prevention.
So
I know
that's to me, that's the meat of this conversation.
Yes.
Please, if my network breaks up during this, give me another opportunity to repeat this. Last week we talked about, a couple of weeks ago we talked about an ounce of prevention is worth a pound of cure. And at this point, I would include hepatitis A in this conversation. We discussed how you get it. And so a key proportion of prevention is ensuring that these two things do not mix, the blood and the blood. Those Make sure that blood is appropriately screened before you get it. And two, know your status. I would like to declare to the world that there are very effective vaccines. And Mr. Lambert, I hope the next topic we talk about on Southern Cameroon, as the Southern Cameroon's Medical Society, is on vaccines. Hepatitis A and hepatitis B have two of the most effective vaccines known. Hepatitis B vaccine has driven down the incident, that is the number of people that come down with hepatitis B. In fact, it is even recommended that a mother who has hepatitis B at the time of delivery will start giving the vaccine and the antibodies to that newborn baby in an attempt to prevent them from coming down with hepatitis B. The vaccine is highly effective, and for a majority of people, you take 3 shots over a span of 6 months, and it prevents you from the rest of it prevents you from getting hepatitis B for the rest of your life. You get a couple of vaccines over 2 months for hepatitis A. It prevents you from the rest of your life from contracting hepatitis A. And let me be honest, vaccinations against hepatitis B is one of the things that has led to a decrease in the incidence of liver cancer. Let me repeat that again. Just simple vaccination against hepatitis B will decrease the risk of my brothers, me, coming down with liver cancer. So I would once more urge that hepatitis B vaccination be considered seriously. It is such an important concept that it is a recommendation, a public health recommendation in the United States and in many places around the world that every newborn baby gets the hepatitis B vaccines. Every newborn baby gets the hepatitis B vaccine, no matter the status of the parent, no matter whether they will be exposed at some point or not, because an ounce of prevention is worth a pound of cure down the road.
Yeah, just before I let you go, and again, Dr. Tunga, for welcome. We were talking, and I'm sure your system was down. We're going to come to you to talk about how hepatitis, as a cardiologist, what is your point of view? But something you just mentioned, vaccination. I mean, how about adults like us? How do we prevent it? Do we also go and get vaccinated, or what do we need to do?
I recommend if you are not vaccinated, you get vaccinated. Certainly, if your status is not known, it may be reasonable to get tested. We also have effective blood tests to determine whether you are protected or not. Because remember, let me also step back and say 90% of adults who get hepatitis B may clear it on their own. Let's also get that as a fact. 90% of people who get hepatitis B as an adult can clear it as their own. So some people will get their protection because they have the hepatitis B already. And some people will have their protection because they had the vaccine. Now, if you're uncertain, there are blood tests we can run to know whether you are protected or not, or whether you have it or not. And if you do not have it, then you will get these vaccines, the three injections given over 6 months, and it prevents you for life. In fact, it is a recommendation that if your partner has hepatitis B, it is my routine recommendation that all family members get vaccinated to prevent them from incidentally being contaminated with the body fluid. You know, a father may just be kissing and playing around with their child, and in the process give the child hepatitis B. It's uncommon, but it's conceivable. A father may have hepatitis B, get happily married to a beautiful wife, lovely wife, who doesn't have hepatitis B, and in the course of exercising their matrimonial rights, transmit hepatitis B to the spouse. But if that wife gets vaccinated against hepatitis B, then it's almost zero chance that the husband will ever transmit it either to the mother. And any child subsequently also gets vaccinated. So to you, Mr. Lambert, another take-home point is to our audience and to all physicians, recommend that your brothers, your family, your patients get vaccinated against hepatitis B, especially those that are high. And for every newborn baby they should get vaccinated. And if you happen to come from a family whereby somebody is known to have hepatitis B, every close relation should get vaccinated.
So again, you are listening to the Southern Cameroons Medical Society, and we are currently talking about hepatitis in the context of the World Hepatitis Day, which was celebrated last week, July 28th. There is a comment here from Marilyn Mokom. Preventative care is awesome and great in maintaining proper health. But for our people back home, how do we engage in preventive care since our people only seek emergency care?
That's a great question, and that's why this conversation is very important. We believe education is an important aspect of this. We say if you don't know it, you cannot benefit from it. Education is power. And we believe that we have to equip you with enough knowledge so you can begin the pursuit of more knowledge. These sessions, organized by the Southern Cameroons Medical Society, is our own opportunity to equip our citizens, to equip our brothers, to equip our colleagues, to equip our patients with enough knowledge so they can begin the thirst for more knowledge. Because if you do not know it, you cannot benefit from it. And we hope that at the end of today, a proportion of our population would have been elevated to having more knowledge and more education about hepatitis in general and all the other topics that the Southern Cameroons Medical Society will be bringing to you.
Dr. Menjo, I mean, any contribution towards that?
Well, again, as my colleague Dr. Foster had said, prevention is better than cure. What has happened is the pain that you go through trying to treat a disease that could have been prevented by a simple vaccine at any age. Those of us who may have been born in those days and when this was not recommended practice, meaning vaccination of newborn babies just after birth against hepatitis A and B, can still get vaccinated at any age. And you, as Dr. Foster rightly said, can you imagine a family man just playing with his family, with his kids, and transmitting such a deadly virus that has consequences down the road? And I want us to be able to, to pull away from this aspect of always having taken a medication to treat something that we can prevent. So these infections are preventable. The consequences, once the disease has progressed, are multiple. And the quality of life that you may have with the complications of these diseases is something if you can prevent, that will be the best thing for anybody. And we recommend vaccination at an early age, screening, and for the practitioners who are seeing our people in all the various hospitals and health centers, please be aware that of the prevalence of this disease in our own part of the country. Please screen the patients and offer vaccination to everybody. The patients themselves may not know, but if the physicians and those at the forefront do not give them this option, they may not know. And unfortunately, once the complications are there, it is a 50-50 type of thing. Those who survive, and even the death from chronic liver disease or cirrhosis is very, very painful. That's what I think. Yeah.
So thank you, Dr. Menjo, Dr. Lambert. Allow me to jump in again. Let me wear on now my public health hat. Now, when we talk of prevention, there are multiple levels of prevention. There is the primary prevention and the secondary prevention. When you prevent yourself ever catching the disease, you are dealing with primary prevention. Any point of prevention is great. Now we are telling you that if you have never had hepatitis, it is worth preventing. Now, those that have already had it, the vaccination is not the preventative option we have for you. The preventative option we have for you are those downstream consequences. There are things we can do in the medical community to work with you to prevent you from a majority of you. We cannot prevent everybody. To prevent a majority of us from getting the downstream consequences of dealing with hepatitis C. We've talked about cirrhosis and the swelling of the liver. We've talked about damage to the kidneys. So, one, know your status. Once you know your status, you will know the appropriate next step you would have to take for prevention. If you do not have it, your appropriate next step is the vaccine. And if you already have it, the appropriate next step is to understand its full extent and how to prevent the next step in you.
So I think while we are talking about this prevention, because we are talking about it in the context of people who only seek emergency help, I would like to switch. I mean, at the basic level, you already mentioned the how would I know? What are some of the symptoms? Isn't it yellow eyes, your urine, and all that? Vaccination. But I think at the basic level, what do people need to do in order to take care of these organs? Okay, what do I need to do to take care of my kidney? What do I need to do on a daily basis just to make sure before I even go out to seek the doctor to say, hey, check this level for me? What are some of the things that people should be doing? What should I do to take care of my kidney in order to, I mean, we have talked about how to prevent it, but I'm just looking at it at the basic level. Dr. Menjo.
Well, there are, some kidney, if we have to, deviate a little bit and talk about general kidney problems, and hepatitis is just one of the causes of chronic kidney problems. There are some that are related to lifestyle, meaning, well, because you are diabetic, because you are hypertensive, because you have heart failure, because you have liver, you end up with having kidney damage from those conditions. So lifestyle is everything in most of these diseases that are known as metabolic. In order to prevent chronic kidney disease, kidney damage, is, well, if you live a healthy lifestyle, eat right, appropriate diet, regular exercise, weight loss, and having regular checkup. And because most of the time, as I said at the beginning, that the kidney diseases are asymptomatic, meaning people don't have a symptom when these things are occurring. If you never show up at a doctor to get screened or to get routine checkup, nobody will ever know about it until it is already too late. So making sure that you get regular checkup, and you don't necessarily have to go to see a doctor when you are sick. This is primary care. People have to learn to go to see doctors even if they don't have any symptom. That is key. Primary care, that's where some of those diseases are detected at a very early stage and preventable, and then they can have impact. If you wait until you are having symptoms, unfortunately, it may be too late. So my advice, well, healthy lifestyle, regular exercise, go have regular checkups, and there are things that will come whether you do the right thing or not. These are they are not on you. Genetic diseases, you don't choose a family into which you are born, so that one is beyond you. And there are some diseases that are totally random. That one is a different scope. So as far as preventing kidney disease in this context, screening, primary care, healthy lifestyle, that's my recommendation.
And thank you so much. And before you come in, Dr. Foster, Dr. Tonga just sent something in because he's unable, he's having technical difficulties, and he's actually posing a question. And I'm sure this is going to go to you because you mentioned it. He says, thank you for emphasizing vaccination to prevent hepatitis B. Some people think vaccines are for children. The vaccine is now part of standard plan for young children. What about adults? Is the hepatitis vaccine equally effective for adults and teenagers? should we all get this cheap vaccine if we were not vaccinated? Dr. Foster.
Well, yes, the answer is yes. The vaccine is effective for adults, and there hasn't been a single year gone by that I have not administered the hepatitis A and OB vaccine to more than 50 patients who are adults. In my routine care, I treat patients that have cirrhosis. I treat patients that already have hepatitis B and or hepatitis C, and it is my routine recommendation. I would even alert you that I've treated people as old as in their 70s with the vaccine. So I would urge anybody to prevent themselves. That's because you never know when it will come knocking on your door. It is easy in hindsight to look and say, I should have, could have, would have. But when you are looking in front, what you have as your best tool is prevention. So to answer Dr. Tonga's question, and it's unfortunate he could not be part of this presentation, but I trust he would be joining the panel down the road. Vaccines come in different flavors, and vaccines, some are meant for children, some are meant for young adults, some are meant for adults, some are meant for men, some are meant for women, but they're all tailored to fit the context. And again, my hope is we should dedicate one of our upcoming sessions to fully focus on vaccines. And in that general context, I hope this conversation will come up again.
So, since we are talking about vaccines to prevent, is there any cure for hepatitis of any form?
So yes, and that's why one of the things, Mr. Lambert, and our listening audience, that we love to do in medicine is we do not just want to know this for the fun of it. And toast my hand, I've got it. We want to collect information that will make a difference in your life, will make a difference in your family's life. Now, there is some information we collect that may not make immediate difference to you, but it has enormous difference to play in your family's life. In the case of hepatitis B and hepatitis C, we have effective treatments. Since 2014, we actually have a cure for hepatitis C. Now, this also goes to say, now, there should be no stigma. If you think you've got hepatitis B, you think you have hepatitis C, there is no shame to showing up, confessing to got hepatitis C, no matter how you got it. Because owning up to your mistakes of the past is how you become better in the future. For hepatitis C, we have a very effective medication that since 2014, we treat the majority of people for 12 weeks and cure over 98% of them.
If I may,
yes, sure.
Yeah, if I may even chime in. I remember I said we are also involved in kidney transplant and a little bit of organ transplant, and there is a lot that has happened, especially with people with kidney failure that need transplant, and with the kidneys, with the donors that are coming from people who have had hepatitis C. It used to be an absolute contraindication to transplant an organ from a donor that was carrying a chronic condition like hepatitis. But with the advent of effective treatments for hepatitis C, people are actually being transplanted. They are getting kidneys from donors that are Hep C positive, because we know there is a cure that is almost 99% effective. This does not happen a lot in medicine, where you have a disease and you have a cure rate that is topping 99 to 100%. So these kidneys that used to be discarded because they were coming from people who had hepatitis C, they are now being welcomed and given to either donors or recipients who are Hep C themselves are positive, or those who never even had Hep C, meaning, well, I never got the disease, but I'm getting a kidney from someone who had the disease, because there is treatment that is 99 to 100% effective. That's how much we have, how much we've come along. So there is an effective treatment, especially for Hep C, Hep B. I don't know the efficacy of the therapies that we have now, but for Hep C, there is a lot that has happened since 2014, as Dr. Foster was saying.
So, I mean, we plan to run for 1 hour. We are 5 minutes over. I want to give another 10 minutes because there are two things I want us to kind of handle. I think when we started off, we missed the distinction between hepatitis A, B, C, D, and E. Dr. Foster simply explained that these are, I mean, I'm sure the first one, 4, A, B, C, D are viruses.
All of them.
So,
We're
okay.
focusing just on viruses.
Okay, what is the difference between each of them?
You see, it's 4 of us. It's 3 of us on this show, right? You can say we are all humans, but Lambert is Lambert, Dr. Menjo is Menjo, and Dr. Dita is Dr. Dita. That's because we have unique signatures. We have unique information in us that would distinguish us. You heard Dr. Menjo made mention of something called antigens. Antigens are things that are produced in specificity to kind of your signature, kind of your this is me, this is your flag. So when you study microorganisms, you would realize that each microorganism is unique in its own right. It has its own signature. Meaning, if I go to test for this and I sample this potion and run it, it's almost exclusive that nothing else will come out with this signature but this. That is what makes us distinguish one organism from another, one person from another. It is on those basis of investigations that we realized and have come to understand that there are multiple things that can cause infections of the liver. There are multiple viruses that can cause infection of the liver. Some of them are called RNA viruses, meaning they carry their genetic material comes in the form of RNA. Some of them are called DNA viruses, meaning their genetic material comes in a DNA. That unique signature that they carry along with them would help us know what type is what type. So, for example, hepatitis C is an RNA virus. Hepatitis B is a DNA virus. So all of these viruses have a signature. Now that you brought me back to this, please allow me a second to expand on what all these viruses are. Hepatitis B and hepatitis C are known to cause chronic disease, meaning if you can have it today and then have it for the rest of your life. Hepatitis A and hepatitis E are not known to cause chronic disease, at least not to the extent that we understand for hepatitis B and hepatitis C. Hepatitis B and hepatitis C are transmitted mainly by body fluids coming in contact with body fluids and with blood mixing with blood. Hepatitis A and hepatitis E are mostly transmitted through the mouth and the anus. It's fecal, oral. It plays around the feces. It plays around drinkable water where feces can mix with. It plays around food where things that go into the mouth or mix with stool or with your hands can go into. So you will not get hepatitis A or hepatitis E from getting a blood transfusion, but you will get hepatitis B and you can get hepatitis C. You can get hepatitis A and hepatitis B from drinking contaminated water. I think recently there was an outbreak. I think it's hepatitis A or hepatitis E. I think it's hepatitis E in the Lake Chad Basin. I may be mistaken. But you see that hepatitis E or hepatitis A in the Lake Chad Basin, and including the River Niger, because the source of water was contaminated. People were drinking it, and they came down with this infection, because that's how you get it. And when you get it, you'll get all of that yellowing of the eyes and this. But if you get it today and I come back to you next year, you would have been prevented. You would never get it again. And it's very rare anybody would ever get it from you using blood. Hepatitis D is unique because you would never get it. It would only manifest itself if it's exist in somebody who also has hepatitis B. So by this, Mr. Lambert, you can begin to see that each of these viruses has its own unique signature. One of it, the list of which not even being how you can get it, not even being how you can transmit it. That's what helps us distinguish one of the forms of viruses. Let me take this opportunity to also address. I talked about pregnancy and hepatitis B. We also know in the medical community that hepatitis E is very dangerous in pregnant women. Hepatitis E is very dangerous in pregnant women, especially if contracted in the third trimester. That is the last 3 months of that pregnancy.
So I don't know, maybe Dr. Foster, before I let you go, I really wanted to zero down on what are the prevalent, I mean, what are the types of hepatitis that you think are prevalent within our community, both our immigrant community here and maybe back at home in Africa?
But
All of what we discussed, I think Dr. Menjo wanted to say something.
I just happened to stumble on the material I was reading from Cameroon in regards to this World Hepatitis Day. And there is already an NGO in Cameroon that is, calling out and seeking out patients to receive treatment. And according to them, the prevalence of hepatitis in Cameroon, B especially, is about 13%.
Wow.
Are living with hepatitis B. And then the statistics that I was reading, they seem to, the prevalence actually is growing. In 2018, they had about 9,600 cases. And then in 2019, they had over 12,000 cases of hepatitis B. And then the problem was that the treatment used to be very expensive. And then the government, through these NGOs, the government has tried to cut down the cost. That used to be about, let's say, $250 a month for treatment of hepatitis B to about $50 currently. So it's, I can imagine somebody is having to spend over 125, 130,000 francs CFA to get treated for hepatitis B. Most people won't afford that, even those in middle class. So there is some effort. There is an NGO, SOS Hepatitis, that's currently actively helping and seeking out those who may have chronic hepatitis B. So that's the latest I had on Cameroon. About the immigrant population or in the diaspora, I don't have any numbers. Maybe my colleague, Dr. Foster, knows more about it.
So you're right. It's in double digits back home, and I would also argue it's underreported. But I want you to know that hepatitis B and hepatitis C is a big deal back in the sub-Saharan continent, back in the southern Cameroons. One of my friends died at the age of 35 because he ended up with hepatitis C unbeknownst to him. He then developed liver cancer from hepatitis B, if I misspoke, hepatitis B, and died shortly after from the complications of that. And some of these stories abound, and people don't even know it until it's a little too late. Recently, especially in some of the hepatitis C and hepatitis B works we've done and published in the US, we have actually noticed that with the vaccinations and the preventative measures in the US, that population of hepatitis C should have gone down. In fact, the majority of people in America who have hepatitis C were born between 1945 and 1965. For a lot of the other people now work having it within the past years, we realize it's the immigrant population that's now moving into the country and bringing it. The immigrant population will reflect where they come from, because what Dr. Menjo is you and I. That's where we come from. And then, and you would also realize that the way we get it back in the southern Cameroons is different from the way we get it in America. For example, if they do not screen blood back home, I remember, you go to the hospital, you need a blood transfusion. They call the next family member. He needs blood, she needs blood, and they draw the blood and they give it to you. I'm not sure whether it goes through the rigorous testing. And that's why I would also urge on us, the medical society, to come together and ensure that we improve on these standards of practices back home to minimize the risk of this transmission. I talked of the medications and preventing it and the vaccines. We may not have enough of those back home. So you can imagine during the process of childbirth, their mom had it, their mom never knew they had it, delivered them. During the childbirth process, blood mixes, the baby gets it and goes through life with it. So a lot of us get that vertical transmission as opposed to here in the immigrant community, whereby it's men having sex with men through the rough means, heterosexuals that are transmitting hepatitis B, and people involved in IV drug abuse that may also be getting it. Back home, we used to use these needles, as I said, syringes. They give you your injection, sterilize the needle, use it in the next person, and you're always hoping that that cooking of the needle was being cooked enough so that all the viruses would die and that the person was actually cooking it. Because if they don't do that, then you can also get it. So all of these things are meant towards preventing that. But I would argue that the prevalence back home is in the double digits and it's underreported because nobody has actually gone there. Dr. Menjo, you're just sharing the link regarding the NGO where people can go for that care. The hepatitis C medications were quite expensive, but hepatitis C is such a global problem that despite its cost, the World Health Organization put those medications on its list of essential medications.
Thank you very much, and I really want to appreciate our audience. We had Marilyn Mokum, great discussion and highly informational. Thanks to the panel, and my brother and friend Celestine Tatum, an attorney. Excellent presentation by our medical panel. Thanks, Mr. Mbom, for this initiative. Our last question comes from the one who was supposed to be here, Dr. Tonga. He has something again, and this is going to be our last. Could you please touch on the interaction between viral hepatitis and alcohol? Seems like a double whammy.
Thank you, Dr. Tonga. I think you were struggling to join us and you missed part of this conversation again, or maybe my network was breaking up. When I talked, and it's not only hepatitis and alcohol. Mr. Lambert, you remember I said in mathematics 1 + 1 equals?
Equals 2.
2. But when it comes to alcohol, hepatitis, HIV, 1 + 1 equals?
5.
5. So in simple terms, Dr. Tonga, that's the answer. These things do not just add up 1 + 1. They have a synergistic effect, meaning when they come and they coexist, they are more potent than when they exist 1 + 1 independently. Think about it. You have only so much liver. When you have hepatitis competing to damage the liver and alcohol competing to damage more, then the damage is accelerated. And you don't even know of other genetic modifiers that you have in the body. You don't also know of other autoimmune diseases that you have in your body. And you don't even know of other drugs and chemicals you are exposed to that would even modify this risk. And so you can easily push yourself over the hump. No wonder we would, one, advise people to drink in moderation because just alcohol by itself has its downstream consequences on the liver. But people who already have hepatitis B, hepatitis C, you should strongly discourage alcohol because in that scenario, 1 + 1 equals 5. And we can talk more just about hepatitis and alcohol, but people who are even co-infected with HIV even have more damaging effects on the liver. We even also know that the treatment for these hepatitis for people who are co-infected with hepatitis B or hepatitis or HIV is even more specialized, more tailored, because they do not respond than the average, as the average person will respond when it comes to their treatment. So hopefully that sheds more light to Dr. Tonga's question.
So you have been listening to the Southern Cameroons Medical Society, and we have been addressing the issue of hepatitis within the context of the World Hepatitis Day celebrated July 28th. And we have gone through, at least at the basic level, describing what hepatitis is, an inflammation of the liver, different types, what some of the symptoms are, some of the remedies, and how we can prevent them. And this, the last minutes that we have, Dr. Foster, any last words?
No, thank you. Thank you for this platform to help us engage our community, to help us engage our colleagues, to improve healthcare delivery, particularly to the citizens of the Southern Cameroons and to people of the world. Happy Hepatitis, World Hepatitis Day, we use this opportunity to enlighten ourselves that there is a lot of progress yet to be made despite the strides that we have made. We want you to at least have some take-home points today. An ounce of prevention is worth a pound of cure. There is an effective vaccine against hepatitis A and hepatitis B, and we urge you to know your status and get vaccinated. We urge you to protect your family, your colleagues, and your friends from coming down with hepatitis because an ounce of prevention is worth a pound of cure. The second thing we want our community to gather from this presentation is you have to know your status, not only as it pertains to hepatitis B and C, but because hepatitis is a silent killer. It may show up 10, 20, 25 years after the fact. So when you go in for your routine preventative exam, always find out what your liver numbers are and what do they mean, because that may be the first trigger that gets you started on the road of preventing the downstream complications of hepatitis. Finally, this is not a foreign concept to you and I from the Southern Cameroons. This disease is very common in our community, and we have to take it seriously because this is one of the things that we can do to prevent. We are already being cured by so many things. Here is an area where we're being cured that we have a lot of it within our control. Let's take charge of it and prevent ourselves. And once more, I would like to thank the Southern Cameroons Medical Society for enlightening the people of Southern Cameroons and for giving us an opportunity to be a voice and a healthcare educational voice for our people. Thank you, Mr. Lambert.
So thank you very much, Dr. Foster. Thanks for all you do for the society. Again, this show was brought to you by the Southern Cameroons Medical Society, and from what you can see, this is a civil society association made up of medical practitioners who have sympathies, have origins, or have links to the Southern Cameroons. It has nothing to do with politics. We are not engaged in the politics of the region. The aim of the community is to bring together a group of medical practitioners, medical doctors, dentists, nurses. If you are engaged in that field, kindly consider joining the Southern Cameroons Medical Society. You can check us out at www.scms-global.org. I have that on the screen there. It's a little difficult reading that through. But this is going to be every fortnight, every 2 weeks, we are going to come on and we're going to choose a topic. Today, we're talking about hepatitis. I've learned a lot. I want to thank the doctors who showed up today, who are on the show. Dr. Foster, Dr. Menjo, Dr. Chobufor also had some hitches. He was actually at the hospital, working from the hospital. And of course, Dr. Onfor Tunga, who joined twice, but given the audio issues, could not be with us. So I'll see you in 2 weeks, and we'll be able to advertise well in advance. We're going to be able, at least this is going to go up almost immediately to our website, and we'll circulate this for the sake of the audience. Thank you all. Have a wonderful Sunday, and check your health. Take care of your health. Do the basic things, as Dr. Foster keeps saying. An ounce of prevention is better than a pound of what?
Cure.
Thank you very much. Bye for now.